Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. Thank you to our Pedo Teeth Talk sponsor, Hugh Freedy, for helping us bring you great content. We couldn't do this without them. Visit them at www.hughfreedy.com. That's HU-FRIEDY.com. We're here today with Jade Miller and Warren Brill. I will introduce them both briefly. Jade is APD congressional liaison designee, has been a full-time private practitioner in Reno, Nevada since 1983. He became involved with his local dental society 30 years ago, and that early beginning led to leadership and service ever since. Within the APD, Jade has served as past president, district trustee, and the governance task force, and on the governance task force and councils on continuing education and communications. He is currently chair of the safety committee under the Research and Policy Center. Jade was also part of the inaugural APD Leadership Institute and Advanced Leadership Institute. And did I mention president of APD? In Nevada, Dr. Miller has also served as president of the North Nevada Dental Society, Nevada Dental Association, Nevada Academy of Pediatric Dentistry. Nationally, at the American Dental Association, he has served as delegate for the 14th District on the Council of Dental and on the Council of Dental Education and Licensure. He's been involved in hospital leadership. The governor appointed him to the Nevada State Board of Health, where he was elected the first dentist as chair of the board, serving for 4 consecutive years. He's done a lot. The governor has also appointed him to Medicaid Medical Advisory Committee and Board of Dental Examiners, where he served as president. He has appointments as associate faculty, University of Pacific School of Dentistry, University of Washington School of Dentistry, and University of Nevada School of Medicine. Dr. Brill, he's the one with the bow tie here to my left, in case you can't tell them apart. Dr. Brill is also APD's congressional liaison designee, received his dental degree from the University of Pennsylvania, and did his specialty training in pediatric dentistry at the University of Maryland School of Medicine and the Johns Hopkins University. He received his Bachelor of Science from Moravian College and Master of Science in Hygiene degree from the Graduate School of Public Health at the University of Pittsburgh. He's a diplomate of the American Board of Pediatric Dentistry and a fellow of the American College of Dentists and the International College of Dentists. Dr. Brill served as chairman of the Oral Health Advisory Committee to the Secretary of Health and Mental Hygiene for the state of Maryland. He's a member of the ADA Aetna Advisory Committee and is consultant for pediatric oral medical services for the FDA. Dr. Brill has served as a member of the Legislative Affairs Committee of the Maryland State Dental Association and chair of the Legislative Affairs Committee of the Maryland Academy of Pediatric Dentistry. He's also clinical associate professor at University of Maryland. He's also past president of APD and has served as district trustee, chair of the Council of Government Affairs, and a member of the latter of the Council of Government Affairs. He was the 2009 recipient of APD's Pediatric Dentist of the Year, and he maintains a full-time practice in Baltimore. I got to stop picking people I'm interviewing that have so much success, because now I have no time to ask questions, but there will be a few. So, gentlemen, you're just starting on this, and, Heber's been doing this job for a long time. You decided to follow in his footsteps. It took 2 of you, I thought it might be 3, to do that. And so imagine you thought about your schedule of your practice. Your practitioners have some ownership or have had ownership in offices. So how do you juggle your schedule so you can travel here all the time and do this?
The traveling for me is quite easy because I only live an hour away. But what we do here as advocates is very, very important. And the few days of the year that I'm out of the office pales in terms of what I can accomplish for children's oral health by talking to legislators and their aides in terms of legislation that will eventually get passed and help millions and millions of children.
My location's a bit different. I'm in Reno, which is way out west, so when I need to come out to Washington, D.C., I really need to allow 1 day to travel in and 1 day to travel out. So that really increases the time I'm out of my practice. So when Warren and I are going to be looking at when to come and visit, we look at the calendar when the House and Senate are going to be in session, so we can be as effective with our time up here. So that is, the key is when is the best time for us to be here, and then we work around their schedule.
So what do you think, in your experience, is the best way for us to get our ideas across? We just spoke with some members, staffers, and they told us from their perspective. From your perspective, how do we get our ideas in the short time that we have with the members? How do we get it across to these staffers? And sometimes the staffers are very young. There could be interns. But our goal is to get the message into what could become legislation to make big changes that are important to, obviously, 350 people who came here today to work on this. How do we get that across, Jade?
I think it's important that we all consistently say the same message as we go in and pick 2, at the most 3 items that we want to get that message across. And then when Warren and I are up here, we also look at who are the decision makers on those committees that are most important that we engage. So they are, in many ways, the switch throwers. And then lastly, it's your efforts as grassroots. That's going to be ultimately really critical to this.
The first thing that you need to do is understand the issue. And you learn the issues by first reading about the legislation, then talking about people that it affects, the patients that you deal with, and then the experts within the academy that know the technical aspects, so that when you go to Washington, you know the question to ask. And as Lauren and Jamie said, you want to approach it in a personal way that they all can identify, because you all are peers, and it's much easier to accept something coming from somebody that you feel kinship to. So you want to make it on a personal level with as many personal anecdotes as possible relating to the patients, etc., so that you can translate the technical aspect of what the bills that you're interested in are to how it will affect people and the children that we serve.
I want to tie a couple of questions together I have. That is regarding the fact that, as mentioned, we often encounter the staffers as opposed, in fact, most of the time, the majority of the time, you're not going to meet the member, the senator, or the congressperson. You're going to meet a staffer. And many times they're interns, they're very young looking, or actually both. But we want to get our message across, and I think particularly for the residents, the large number of residents who are here with us today, I think that's a great opportunity, not only to talk about the future, which is represented by our residents, but it also appeals to those staffers directly. And when you tie in the stories that we have, practitioners are going to have more stories. The residents might have less stories, but more passion for the future, perhaps. So how do you tie all those things together, knowing that most of the time we're going to see a staffer and not the member themselves?
Well, as you just saw with Lauren and Jamie here, the staffers are really one of the most critical aspects of the people we meet with. As you can see, they're bright, well-educated, and they really are the experts in their area of expertise that we need to educate as to what our issues are. As we look at how are we best able to work with them, I think it is sharing the stories like Warren and Lauren had just mentioned, but also as we are going to work with the member of Congress, there's really developing relationships and convincing them that this is an issue that's going to be important for them.
In terms of the member, it's much easier to meet the member of Congress or the senator back home in the district. So find out when they're going to be there and then call their scheduler and make time. They want to talk to you. They want to hear from you. And when they're not in D.C., you don't get 5 minutes. You might get an hour and a half. So take advantage of every avenue that's available and don't hesitate to call. They are, by and large, very generous people with their time for you when they're not in their district. They want to hear from you, and you'll be able to explain things to them that they didn't necessarily know before. And again, always bring it back to the constituents that they have. Always remind them that what you're doing is not for you, but for the voters and the children that are affected by their legislative acts.
We will now pause for a word from our sponsor.
Hugh Freedy is the global leader in dental instrument manufacturing, offering pediatric restorative solutions that keep you performing at your best. For more information on Hugh Freedy products, visit www.hughfreedy.com/AAPD crowns.
I want to talk about the relationship building aspect. So much of our success has been based upon relationships that have been built over many years. And for those, whether coming the first time or just a few times or over many years, you start to recognize the staffers, you recognize, although they change, you recognize the representatives, the senators, they recognize you. How can we focus on the relationship part, not just the message we have today, but on the actual relationship so that when we need to get a message delivered, we have that strong relationship? So what are some of the things we can do to build those relationships with the representatives, senators, and staffers over time? I'll go to you first, Warren, on this one.
The first thing you want to remember is that they have to identify who you are. So after you talk with them, when you get back to your home, to your office, immediately send them an email to remind them of the meeting that you had, thank them for their time, and then ask them if there's anything that you can do to help them. So they know who you are by face, by voice, by mail. The more you do it, the easier it becomes. And don't hesitate to call them by their first name and have them call you by your first name, because when it becomes personable, it becomes effective.
In addition to that, I think it's important, and Heber has a line that is really effective, and it's help us help the kids, help us help the children. And I think as we know, optimal oral health for children, that is our tagline. That's what our motto is as an organization. So I think it's critical. This is not about us and our membership. It's really about the children that we serve.
Which is what makes us unique as a specialty, that we care about a population, not a condition or a specific event in one's life, that we are managing the growth and development of individuals in a lot of different ways. And I think that appeals to them. The storytelling, I hear a lot, that if you have a story that you can tell personally, it seems to, based on your own experience, makes a big difference to the staffers. So I just have a couple of questions left in our limited time, and one of them for both of you is, why do you want to do this?
Early in my career, when I was working with Harry Goodman, who was the state dental health officer in Maryland, it became apparent to me that I could only help one child at a time when I was in my office, but Harry, with the stroke of a pen, could help thousands and thousands of children. That's why I want to do this. I get great satisfaction of seeing that child become healthier, but I'm getting even more satisfaction by knowing that I can outreach to many, many more lives by doing advocacy than just sitting drilling.
And for me, certainly the mission of pediatric dentistry is really children's oral health, and that really helps drive me as to why would I want to do this. Having been involved in state agencies and dental education, but really my heart and soul is a private practitioner for the last 35 years. And as Warren said, we help one child at a time. Here's an opportunity to really expand our reach and carry the message from our membership and our association.
So my last question related to that as well is, you're serving a national role. You're representing us nationally in coming here periodically throughout the year to meet with congressional staffers and legislators themselves. But you also need to work with the constituents from those districts. So maybe the chair of Committee X, which is really important to us, is in North Carolina. So you have to work with the local people, both locally and here. So how do you work all that out? Since you're going more often, we're going mainly once a year. How does that all work between visits so that you connect with our local constituents?
Joel, I think that's a great point. And that is really the PPA program of the Public Policy Advocates, which is this conference, is what this is all about. And it really was a stroke of genius by the Academy to develop this, because you have relationships and in your districts with your House representative or your senator. Warren and I and Heber can't meet with all of them, and we don't have relationships with all of them, nor will they let us in their office necessarily if we're not a constituent of theirs. So it's really critical that we utilize your relationships to help us nurture that broader perspective. So I think if you have a strong relationship with a member of Congress, let us know, let the Academy know that you can help us develop a relationship with them. So that's where you need to help us.
And it goes a step further. Jamie, who is here, has been able to help us reach out to other offices in the House. Lauren has been able to help us reach out to offices in the Senate. But we don't get there unless we have a connection to that district or to that state, and that comes through you. So it's very important that we all coordinate together at every level, and at all times we remember, as Jade said and as Heber says all the time, it's not for us, but it's for the children that we serve.
This is great. I think in putting it all together this morning, I think this is one of those rare opportunities in doing this legislative work and the advocacy work that we're all doing together where we say that leaders often don't make change. They respond to change, the best leaders. But in this case, we get to make change by responding to change and actually make a difference. And that's what I'm hearing throughout the day today. So thank you both very much for being with us today. And thank you for tuning into Pedo Teeth Talk, where we bring you contemporary issues important to your practice. Brought to you by the American Academy of Pediatric Dentistry. We'll see you here next time. Thank you.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.